Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Fidelum Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Welcome to Humanizing Healthcare Live. We're here at the International Patient Experience Congress in Abu Dhabi, United Arab Emirates. I'm Chris Malone, and I'll be your host for today's discussion. I'm pleased to welcome Dr. Hassa Al Mazrouei, who is the Medical Director of Patient Experience at Sheikh Shakhbout Medical City. Welcome to the program.
Well said.
Thank you very much.
Your pronunciation is excellent. Thank you for having me today, and I'm looking forward to share a perspective of what the conference is about and my experience as well.
Dr. Hassa, I wonder if you could share with us, is there a story or an experience that led you to choose a career in healthcare and medicine? How'd that come about for you?
So I have been an athlete my whole life. I enjoyed sports up to high school, and I thought that's the career I want. Almost 100% sure I'd get into something of tennis or any other sports. During the high school years, I sustained a fracture in my humerus bone. And then that developed soon into trying to understand the human body, what's going on, why are there challenges, and then understanding the healthcare system. For a curious teenager, I'm always asking why, how, what, and all of these questions. And then it got me interested into understanding the human body. And then that soon evolved into actually transforming my perspective of actually going into something where I want to help people. And I think that was a life-changing moment for me that made me feel like, okay, there's more to it, more to caring and taking care of people.
The care you received must have been good if they inspired you, perhaps follow in their footsteps. I don't know if that was the spark that led to it or just your curiosity, but I hope it was a good experience.
Definitely was a good experience in a whole. I mean, the front end of it wasn't a great experience. When your mom is with you and it's a busy ER and you're rushed from school with such an injury, then it's a totally different story. But the after effect of it, of getting the care and everything else, that was the better end of it. Good. Eventually.
Glad to hear it.
Yeah.
So as Medical Director of Patient Experience, what does your role entail? What kinds of things are you focused on now?
It's the most close to my heart role, I'd say. I've been in the healthcare sector, or as a physician practicing, I'm an OBGYN by practice. I've started engaging into understanding patients better, moving towards really solving problems. So as the backbone of the team, so when they had a difficult patient or family or needed further counseling, they're like, okay, call Hassan. And that's the first spark of the story. And then eventually when the role came out, I remember the acting CMO called me up and he's like, Hassa, we have this role and I really see you as a fit. It never came to my mind that I'm fit for it. And then I started researching, reading more. What's patient experience? What is it? As a care provider, you're generally interested in making it better for patients and taking their hand through their healthcare journey. But then you figure out there's more to it. There's a lot of things that you can do in terms of patient experience. And that's what got me into the role. I got into the interview and then successfully passed. Then the passion increased and wanting to give more and provide more and actually transforming the whole care system into the proactive approach into the reactive approach into a more proactive approach, and transforming the mindset of people where and I know this is the highlight or cliche highlight where everyone says we are the patient experience at every single moment, but it's the reality. And until we reach that level where I'm confident enough to say that everyone is playing an impactful role, I'll be then satisfied.
Excellent.
Yeah.
Now, earlier today, you gave a very compelling presentation here entitled Listening is Not Enough, the True Meaning of Patient Experience or Engagement. I was wondering if you could share with us a little bit about what you spoke about. I thought it was very compelling.
Yeah. So I started off by my personal story. So 2 months ago, I was in a car crash And during the car crash, I experienced what a whiplash is, having my seatbelt safety first, the airbag opening up, and then all I could feel is a paramedic trying to get me out of the car. It took them about 40 minutes to be able to extract me out of the car, but then I had a seat collar on, and then I had a full team moving me without me moving. They're like, please don't move your neck, don't move your body. They put me on a board and a stretcher and took me directly to the emergency room. In the emergency room, I'm lying flat the whole time with a lot of pain and feeling very nauseous. For a reason or the other, everyone knew who I was, and they knew that it's a doctor coming in. And I thought that that would transform their behavior. So the person who was leading the shift stood up. Ironically, I'm lying flat down, so I cannot exactly look at who that person is. And she's like, Dr. Hassa, welcome to our emergency. Not that it is a very good welcoming reason, but, and she's like, I'll be assisting if you need anything. Because there is no engagement, because I couldn't see her and I couldn't make a face to who I'm talking to, I can't remember her. So there's no engagement at all. And then I was taken to the room. While lying flat, waiting for my medication to be given to me, I could hear the nurses talk about their lunch experience because the beds aren't far off from the nursing station. And she's like, oh, I had the chicken biryani, how was your food? And so on. And while I'm lying down, I'm thinking, okay, I need someone to come update me. What's the next? When am I going to have my CT? Now, what I didn't add in the discussion today is that I was shifted to the CT scan machine. And the drama over there is a totally different story because I'm in CT scan machine and I had to have the contrast. And I developed an allergic reaction. But the allergic reaction was an itching face. So no one could really make out that I started having a reaction. And then they noticed it when I was on the stretcher and they're like, okay, push her directly to the emergency. And you could see the worry, the scaredness of the situation, or they were worrying, panicking, and wanting to put the order in the system. They're trying to call the physician, and I'm trying to understand what's going on.
And you may have better understood what was going on with them than most people because you recognized the behavior, didn't you?
I did, but I feel like at moments of crisis, people, for a fraction of a second, lose their focus, that there is a patient they need to engage with and talk to. And listening is not enough. And a lot of the empathy talks is about how much you need to listen to the patient, hear out, but I need someone to genuinely take that more engaging approach and actually reassuring me as a patient, we're going to take care of you, don't worry, don't panic, we'll start and so on. I'm laughing about it now, but trust me, when you're in the moment, the anxiety spirals. And you try to calm down because your family is with you. And that's the other side of the story. So your family is non-medical, but your medical makes the whole story different.
I'll bet. And a great reminder that as much as we try to listen and focus, it's very difficult for us often to see the experience through the patient's eyes.
Yeah.
And this experience that you have, you literally had that opportunity. It changed your perspective, it sounds like.
Totally. I think I thought I knew all of the answers of what patient experience requires. But when you live it as a patient, something else comes up. And that's why I'm a strong believer of co-creating patient journeys. So you cannot just have a physician's perspective or an expert's perspective. You need to have the patient, their family. You need to have the medical team on board, the nursing team on board. And to some extent, the guy that was pushing me was more anxious than anyone because I was flying across the hallway, So it's getting everyone's input into how can we make it better for patients and creating it together rather than on your own, of your understanding.
One of the premises of our program is the belief that as care experiences have become more digital, as organizations have been more focused on measurement and efficiency and quality and things like that, at times, care experiences can start to feel like a transaction.
Yeah.
The staff can be very focused on the task at hand. versus fostering and making a relationship with the patient. I'm wondering what you're seeing in your organization. Is that something you have been able to navigate around, or do you face that challenge as well?
So the thing is that I'm always trying to update myself into understanding what is the benefit of what technology can add in. So I just recently came back from Silicon Valley 2 weeks ago, and the whole discussion was about healthcare AI solutions. And it is one of the so many topics that talk about the empathy related jobs cannot be swapped with artificial intelligence. Rather, it can be a tool that facilitates it for all of the care provider. Let's look at the solutions that can support care providers in terms of if they're having a very busy shift and it is quite tensing. There are some healing rooms, and there's a science behind it. So there are rooms that they can step out, have a 5-minute break, and disconnect completely just to start calming themselves down and get back. So it's not totally everything is going to not serve you as a healthcare provider, a nurse, being whoever, whatever your role is. There are things that will help you, and there are things that will be definitely able to facilitate it. So there will be a transaction, and in the whole equation, there might be transaction, but it doesn't mean it's bad. It might be for the better.
I think you make some good points there. And when we talk to clinicians, what they tell us is it's all about time. In many cases, they just feel like they don't have enough time to deliver the kind of connection and relationship they would like. So the degree to which we use artificial intelligence to increase that time, I think can really be a benefit, whether it's time with the patient or even time for myself to recharge and disconnect.
Yeah. So there are like new solutions that are dictation based. So these automated dictations. I find these brilliant solutions if they're going to start working very well for physicians and nursing. I tell them, part of the disruptive thinking really totally different. It's getting people to look at how you can solve problems related to healthcare. And time is definitely one of the big problems. As generations evolve and change, and during my talk I talked about evolution of patient experience and how time is changing, that we will reach a phase where the Gen Z or Gen A or the newer generation don't want this human interaction. I don't know if you have teenagers around at home, but you see how they are. They don't want to have a lot of people talking to them, telling them what to do. They'd rather have a quicker, simpler way to understand what's wrong with them, what's the solution. Interestingly enough, my niece is 16, went into our dermatology clinic, and the clinician's quite young. He's a fresh graduate. They were able to engage in almost seconds because he understood her generation's needs. So he didn't go into like details of how he will make her better. He's like, what great work are you doing for your, and then she sparked conversation for her. So every generation that will come will definitely have a different form of requirements and needs. And I believe that everything will evolve in the horizon.
Well, it's a good point you make about differing generations, because I know that you probably engage, as we hear at the conference we have, there are lots of young and emerging leaders who are coming up in healthcare who might aspire to a role like yours as a medical director of patient experience. What advice or a guidance would you offer them about what it takes to be successful in your role?
I think you need to be genuine. The care element right now is very important. If you're in the field for the wrong reasons, then you'll not be able to understand how to get into the patient experience, because it's all about care, understanding. Now, the skill sets that I evolved later on and developed were related to my mentors, my coaches. So don't believe that you'll go into a job knowing everything. You will need some form of guidance, and you'll need to really excel. I read a book, interestingly enough, that says, what got me here won't get you there. So if you're trying to take a career in patient experience, you really need to have the care element as a foundation, and then start building towards that. And that takes a lot of you building certain skill sets, certain mentorship classes, workshops, depending on what you require. So I generally, I'm a good speaker, so I needed to work on not over talking, and then I kind of take everything emotionally at the start, especially when you're an emerging leader, and you try to like factor in the emotion a lot, but you need to sit back and really think logic and what would make sense and what would make it easier for patients. And this takes for you to develop new skill sets. So I think these are my few advices.
Yeah.
Don't believe that you will come knowing everything in the role. You'll definitely need to evolve and develop. I mean, I recently started exploring the AI world just 2 years back. It wasn't something on my radar, and my seniors for sure were against it. You know how clinicians are. Generally speaking, not majority don't want AI solutions to be a solution that can help because of their lack of understanding, not because it's not helpful.
Yeah, I think you made some excellent points there, and I wish I had learned some of that earlier in my own career, that often we are so moved by our emotions that we react in the moment, whether it's with frustration or impatience or anxiety or fear or what have you. And I wish as a younger person I was better aware of that and took a few moments to catch my breath before I responded or acted or pushed send.
Yeah, true. Yeah, and it comes with time. You cannot, and then that's what I tell everyone. And I generally don't take things to heart. I always know that, I had a very, very amazing mentor when I was a resident, Dr. Aswad. And he told me one thing and taught me one thing that I take as a standard. When you walk into the hospital, you leave all your feelings, all your emotions, everything that's going on in your life aside. Because someone that's coming through that door as a patient requires your full attention. And I believe that, and he said that majority of the healthcare providers, nursing, whoever the workers are, every morning wake up and come to the hospital because they want to make life different for the patients. And no one wants to be at fault or harm or anything towards the patient. So I go by that.
Terrific.
Yeah.
Now, my final question, it's one of our favorites. I wonder, do you have a favorite quote that you can share with us? And if so, why is it your favorite quote?
I have plenty, but I think one of the quotes that I presented was Albert Einstein's quote, and it's within difficulty lies opportunities. And I believe in that. Even when a crisis happens, there are opportunities for us to fix. So never look at any crisis or difficulty as a difficulty. Look at it, how can I transform this into a better opportunity?
I think that's great advice, because I have seen as well that when everything's going smoothly according to plan, nothing is particularly memorable.
Yeah.
But when there is a crisis or an opportunity or a problem, it's a rare opportunity that we have to make a really memorable difference in someone's life. And so I think you put that very well.
Thank you so much.
Dr. Hassa, so much. We can't tell you how much we appreciate your time and your perspective today. Thank you to our listeners as well. Be sure to join us again for another episode of Humanizing Healthcare Live, when we'll be talking with another healthcare leader and innovator. Until then, be well and have a great rest of your day.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Fidelum Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.